cases. Christina is a 9 years old girl, looks well. I would like to plot her on a growth chart. On examination, she is not clubbed and cyanosed. She has no dysmorphic features. Her abdomen is looking full. There is palpable mass in the left lower quadrant. The mass is hard and indents. I suspect it is a fecal mass that may be due to chronic constipation. I would like to inspect perineal area for overflow siling and fissures or fistulas or any pathology like that. In order to continue my examination, I would like to check his spine, his sensation in the lower limb and saddle area, his thyroid for goiter, and his motor system examination. So saddle area is S3 to S5. Saddle area S3 to S5. Sensation around anus and buttocks. This may be due to spina bifida associated with urinary incontinence. Most commonly, it is idiopathic chronic constipation that is affecting 5 to 30% of the case children, and 1/3 of them become chronic also. So, idiopathic associated with megarectum and swelling is common. There may be encopresis, that is a passage that is due to psychological problems in which stool is passed at inappropriate times and in inappropriate places with no underlying constipation. True encopresis in the absence of constipation is rare. However, there are some causes of constipation that is also called red, comes in red signals. Hirschsprung's disease, thyroid disease, Meconium equivalent, and spina bifida. Hirschsprung disease. In Hirschsprung disease, there is a history of delayed passage of meconium more than 24 hours. It can be life-threatening enterocolitis, abdominal distension, with explosive diarrhea, rapid dehydration, sepsis, and collapse. So, in neonatal period, it is very important to be vigilant. So, in Hirschsprung's disease, constipation from birth, chronic abdominal distension and vomiting, and family history of Hirschsprung disease also positive and may be associated with faltering growth. The thyroid, maybe there is a goiter in the thyroid. Meconium equivalent in cystic fibrosis, and check the spine for spina bifida. Constipation is a consequence of neurological and neurodevelopmental or genetic conditions like trisomy, ASD, autistic spectrum disorder, cerebral palsy, and spinal anomalies. Also, the psychiatric condition and encopresis, severe dismobility, visual myopathies, and congenital megarectum. Anatomical or structural defects to be ruled out may be ectopia, stenosis of anus, or pelvic masses. Urinary problem like wetting, urinary infection can be associated with the constipation, or constipation may be associated with the urinary tract obstruction. Psychosocial like child abuse or child neglect are the also causes of constipation. Social lifestyle, change of diet and fluid, weaning, traveling, intercontinental illness, and some medications can cause constipation. Social and family changes like starting at nursery, new school, moving house, changing in the family, problems with toilet training, and psychosocial behavior problem, toilet phobia, deliberate stool withholding, and deliberate inappropriate defecation like encopresis, and maybe metabolic and endocrine hypothyroidism and hypercalcemia, spinal dysraphism, Hirschsprung disease. All these can cause constipation. So in history, it is very important to look at these things. If constipation, how the constipation is treated. It is a multidisciplinary team approach, excluding the local pathology and changing first the lifestyle. Lifestyle change is very important, taking more fluids and taking more fiber diets and toilet training and psychological addressing psychological problems, rewarding technique like star chart, and use of laxatives like osmotic laxatives, macrogols, movicol or lactulose, or stimulator like senna or sodium picosulfate. So in the treatment of chronic constipation, the most important is to get rid of constipation and education of the parents. That is a long-term management, and we will start with osmotic diuretic like movicol or macrocol that will either absorbs water from the large intestine, or it retain the water with him and soften the stool, and it will leave the constipation.